This is different from elsewhere. Are we in the business of curing cancer? Or what are we doing? The word cure is a taboo because I think cure is misleading. Here we talk about healing. We are not healing cancer, we are healing the patient. We tell people, and this is my experience, that there is no cure for cancer, period. Doesn't matter whether it's stage 1, it's stage 2, stage 3 or stage 4. There is no cure for cancer. Well, what does it mean by cure? I mean, it's a very confused red herring, so to say, you know. And I have done some reading about cure, what it means by cure. Actually, there's no cure. They talk about remission. But then the word cure creeps up. If you live 5 years.
That's what doctors say.
Yeah,
yes.
that's what they say. What is that 5 years? That's not magic. There's no magic. It's just happened. Somebody explained. This is a medical doctor, an expert, who explained this. He said, well, you ask the doctor, you go to the doctor and you ask, how long am I going to be? When do I get cured? So doctor was lost. They can't say, they cannot cure you. If they cannot cure you, then there's no reason why you see doctor. So they just toy with the idea. Then they say, okay. If you live 5 years, consider yourself cured. Consider yourself cured. But it's never been a cure. Because I have seen people who have cancer, they survive 9 years, they still get a relapse, a recurrence. My own auntie got cancer, undergone surgery, had radiotherapy. It's 13 years later, she got a relapse. So there is no cure. I read another research from a medical doctor from Chicago University, and he said, if you want to really know that you are cured of cancer, you have to live for 25 years. Now, if you tell the patient that you have to live 25 years to get a cure, nobody goes to the doctor anymore. So that 5 years is, to me, is nothing, meaningless. But that is how the world operates today. So in our center, I always clear, blunt, and loud. I tell everybody there is no cure, and please don't come and ask for a cure because I don't think I can cure you at all. But if you are sick, you are miserable, you come and take the herbs, and I can tell you one thing, hopefully your life can be better. Now, one more thing, it's ethics. I set up quite a high level of ethics. I tell this, if you take the herb for 2 weeks and you don't get any better, then I'm going to tell you this, I can't do anything more for you. Please go elsewhere and find help. The reason is that I do not want to mislead you. And I don't want to be accused by people and say I'm wasting his precious time, the patient's precious time. Because the general accusation today, is that, oh, you go to the alternative, they are quacks, they wasted so much of your precious time and you die because you don't get a proper medical treatment. They have gone and see their doctors. They have wasted enough time with their doctors. They came here, they expected me to cure them. No, the answer is no. But even if I cannot offer you the cure, but if you take the herb, you are no better than what you first came to see me, then I tell you, go away. But most of the time, I win. Patient will come back and tell me that they are better off after 1 or 2 weeks.
They already feel
they feel much better. Okay, so they build You build up the confidence for them. What do you mean by better? It's not scientific. Well, if people are dying and suddenly he doesn't feel like he's dying, then well, do you want? I mean, I mean, you can see that in the X-ray, you can see it in CT scan. I mean, but they feel for themselves that they are getting better.
Right.
So to me, that as much as it's subjective, I take it as an important indicator that they are improving. For example, people come in, they have fevers every day. When they have liver cancer especially, they have fevers. Every evening, at the same time, they get the fever. Then the next day, the fever. So after they take for a week or two, the fever just disappears. What? Is that not better? I'm sure that is better.
That's measurable.
So, in terms of that, ethically, as I said to you, I do not want to waste people's time. But on the other hand, we have to know that they have no other place to go. They have no other option actually. Yeah. I think I used to jokingly tell people we are the last option. The last one stop for everybody.
Yeah.
But trying to be as ethical as like that is trying to be as blunt and say that go away after 2 weeks. And I tell you that sometimes is bad. You know why? The patient was shocked and say that, then after 2 weeks you're going to abandon me. You don't want me anymore. I mean, they have the impression that, well, then where do I go now? So I said, no, not that I want to abandon you. What I'm trying to tell you is that I want to be fair to you. I don't want to get you here, suck you here, and then stick with me. If you are not getting any better, please find someone else. You have heard of what you call a very famous reasoning is that don't send the people to the quack. Even if our treatment is not effective, we still make them come to see us because we don't want them to go and see the quack.
Yes, that was a...
When a patient who has got cancer, they do not come just with a problem of cancer. They do not come just because they have a tumor. They have more than a tumor. Here we spend a lot of time talking to patients. Now, how much time does a doctor spend with a patient? 5 minutes, 10 minutes, maximum half an hour possible. And generally 12 minutes, 13 minutes, and they collect the fees. How much do you learn from 10 minutes? So you possibly have a preconceived ideas already. This fellow got this is this, the X-ray, this is a tumor, that's it. I give the shot and that's it. But I think there's more to it. So here, we sit down. I generally spend minimum half an hour to 2 to 3 hours talking to the patient. I want to know their lifestyle. I want to know their attitudes of life. I want to know what they eat. And I want to know also what's the problem that they are facing today, beside the disease. The disease, no problem. We got a medical report to tell you. But others, you really have to dig it out. Then if you look properly, then you begin to see that if you can patch up all this problem for them, I think you will have a healing. So this is what we are doing. We are not in the business of just curing.
You're going beyond looking at symptoms and giving herbs for those symptoms.
Yes, surely.
Do you give herbs for psychological aspects as well?
We don't give herb to alter the brain, so to say. No, but we do the counseling because we want to make them aware.